Welcome to America's Heroes Group.
Welcome back to America's Hero Group. This is time with our partner, the National Nurses United. Today is Saturday, August 19th, 2023. August is National Wellness Month. Our host is Kelley. I'm Sean Clem, the co-host. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega, of course, of all of our wonderful Scouts Honor Productions. He's not with us today, but we'll be back soon. And of course, see us on WVON.com. You can also hear us on iHeartRadio. Go to YouTube, our YouTube channel, and our Facebook page to see us on our archive shows. And then also, you're going to hear a voice today from someone you hear often with our show, Adelena Marshall. She's a VA mental health nurse, an RN, and our panelist, Carolina Stewart. She is an RN and MSN licensed clinical nurse leader, and we're going to talk about community home health services. How you guys doing today?
Well,
we're doing
great,
and it's our pleasure to for you guys to have us here representing the VA and our veterans and being allowed to get this information out. Carolina Stewart is one of our specialists today that I've invited to join me, and she'll be discussing community home health care.
So tell us about home health care as it pertains to the VA. The first thing I really want to know is, because I kind of been looking at this topic recently, as a matter of fact, and the thing of it is I was curious about in the VA, does the VA pretty much, do they cover comprehensive home health care?
The VA can provide coverage and resources for comprehensive community care and home health services. For the home health services that are provided within our community care service, it is actually one of 4 services or programs that is encompassed into what is called actually the personal care services. So home health care is actually one of personal care services that can be provided within the community care. As we know, the principal focus for these programs is to support veterans who wish to remain at home with appropriate care. For some veterans, that may be use of services to delay nursing home placement. For other veterans who may not be at immediate risk of or actively seeking nursing home placement, the VA personal care services aids in efforts of improving a veteran's quality of life and safety in the home setting. So the beginning or the starting point for a veteran to figure out their eligibility or how they may qualify for these services is to communicate with their primary care physicians some of the needs that they may be requiring at home. Myself, I am a home health nurse coordinator for the Jesse Brown VA, and we do have these coordinators nationwide throughout VAs nationwide. And so with the home health services, what I would do is to perform an assessment, which oftentimes can be done over the phone. We would discuss some of those personal care needs that the veterans may have, whether they are having family members who assist in caring for their personal needs or whether they don't have anybody and they are needing us to pull in from some of our VA-affiliated home health agencies to provide those services. Again, in speaking about the home health services, there are 2 types of services that the veterans have been used to receiving in the past. One is for homemaker services, while another is home health aid. And at this point in time, one of our main directives is to guide the veterans on how to best utilize these services. And then at times we may have to point them to some outside resources outside of the VA if we are not able to assist in their needs.
Let me stop you one second there. So if you can't assist them in those needs, does the VA still cover those services if they refer them outside?
So if they don't meet eligibility, then the VA does not cover those services. And so then one of the things that we are doing, because one of the ways in which veterans would meet eligibility is if they have a service connection. Some veterans don't necessarily even recognize the need for the service connection or what that is. And so I do just want to make note that service connection basically means that a veteran's medical condition was directly caused by his or her military service, whether it occurred on active duty, was aggravated by military service, or was caused by conditions that themselves are service connected. That's one way in determining their eligibility. So if a veteran does not have service connections, then we are directing them to the VA regional office. which I could also provide the number for that. But through the VA regional office, they're able to file for service connection or aid in attendance if a local VA is not able to meet their needs.
Okay. So, Adelena, can you tell us about the experience that the person gets when they have home health care in their home? How many hours do they get per se? And then also, what are the services that they receive when a person comes to their home to help them?
Well, as stated, Carolina is the subject specialist today, and I work mental health, so I would not have all the detailed information that she's able to provide you. So I'm going to ask her to continue reporting to you and participate in that question.
So Carolina, can you tell us about, so how many hours does a person receive if they call in to get home health care? And you mentioned they have homemaker services. What does a homemaker do? And then if they have medical services, what does that person do?
Absolutely. So when it comes to homemaker services are supplemental to the provision of what we call a home health aid. And a home health aid is when a veteran is requiring assistance with personal care, whether that is bathing, getting dressed throughout the day, toileting needs, things of that nature. So if a veteran does not have certain personal care needs that they are needing assistance with, then the homemaker services, which are for light housekeeping, assistance with grocery shopping, laundry, things of that nature in the household, then the veteran would not necessarily qualify for just homemaker services by themselves. The homemaker services are supplemental to the need of a home health aide or their personal care. So when we speak about homemaker, if the veteran is only needing assistance with some of his light housekeeping or industrial needs, then we are directing them to the Department of Aging and or the VA regional office for further evaluation. Now, when it comes to determining the amount of hours that a veteran may qualify for their personal care needs, there is an assessment that each coordinator would go over on the phone with the veteran to go over those certain categories and actually see exactly what it is they're needing help with, whether they're needing someone to physically feed them or just needing someone to perhaps prepare their meals and then they can feed themselves. If they're needing someone to completely bathe them versus someone to help them in and out the tub and then they can bathe themselves. So those hours would depend upon that assessment that we perform, but they can get up to 56 hours per week, depending on their eligibility. And then on top of that, I have to include, as I mentioned earlier, that the home health aid services, they are one of 4 programs within our personal care services. So if a veteran does qualify for a certain amount of hours, they can at that time determine how they would like to split those hours up between the 4 programs, which the home health aid is one of our home services, but then they also have home respite, which is for veterans who have primary caregivers who are already assisting them with daily needs. And then they also have adult day health care services that they can utilize and determine if they would like to divide up those amount of hours they're approved for. So they do have up to 56 hours that they could be eligible for each week. And then they can go about communicating a little bit more how they would like that time to be divided up to assist with their needs.
I was always curious too about that. Because I had a friend of mine who was a World War II vet, and he had private health care come in, but he was in a situation where he needed 24-hour care. And so we had people coming in at their daytime and at night, but he had it all through private. It was all done through private pay. Do your aides go into the home at all hours? Do they provide nighttime services and daytime services, or is it just during working hours?
Oh, no, they absolutely can provide nighttime or even, what you would consider outside of business hours, because our VA-affiliated agencies, they do have caregivers that assist throughout different times of the day and night. They have different shifts. Now, the community care program is more so for intermittent service assistance, so we do not provide 24-hour care. So if a veteran is needing 24-hour care, we wouldn't be able to provide 24 hours in a day, but we are able to assist with some intermittent hours that they can, utilize, but we do not provide for 24-hour care. But that's not to say that the agencies that we're working with do not have caregivers that may work night shifts or evening shifts.
And then as far as like getting help for taking medicine, is that one of the services also, helping them with prescription medications and taking their medications on time and the right dosages and things like that?
Absolutely. So that would be a part of the home health services called skilled services versus the home health aid, which is non-skilled. So yes, within our skilled services, that intent is also to provide services that will support the veteran's ability to remain at home safely. And as you mentioned, sometimes things such as medication management, coming once or twice a week to set up those medications in the pill box, take those vital signs, do physical assessments. We do have services that does allow for that and does provide that assistance, and in which case the agencies and the licensed clinicians that we do assign to our veterans, they are in communication with the veteran's primary care physician along with the care coordinators throughout their time, just to provide those updated reports if there's any change in the veteran's treatment or care plans that need to be performed. So yes, skilled nursing is a part of one of those programs. And then we also do for therapy programs at home. Now, the therapy programs are meant to be a more short-term or intermittent service, because the intent is for our skilled therapy services at home is to empower the veteran, their caregiver, or their family to basically independently perform certain exercises in order to maintain their gains throughout the services. But therapy is also a type of skilled service that can be provided in the home setting.
And then, and his services go as long as a person needs it. Now, what happens if the person, like you mentioned, kind of alluded to, if the person then gets worse or deteriorates? What's then the next step as far as getting them care if they can't be at home at a certain point? Is there another step for them?
Absolutely. And most times then that's when we would get our social workers involved to talk with the veterans and their families to see if certain nursing home placements or what their ideal quality of life or their goal is. If they are not receiving or if they're not having any type of improvement with our home services, then we would get the social workers involved and see what type of outside resource then may they be able to benefit from. We also have end-of-life care, which is hospice care, as well as palliative care, which is not necessarily end of life, but more so for care management, whether that's pain management of some sort, but just to try to maintain them within their condition or their illness. So hospice and palliative care is also something that we can look into if that is what is within the veteran's goal of care.
So what do you think is from your experience in your market, what is the most common care that is needed with veterans that are getting home health care?
Most times, I've been within this role for a little over a year. I was a bedside nurse for over 10 years, and then I came over to the community care side. Just because even within my inpatient role, I do see some of those needs upon discharging the veterans and them just needing someone to provide a little supervision. So most times I'm seeing a lot of skilled nursing needs at home, again, just to provide that supervision with the medication management and the vitals, or just for wellness checks. We have a lot of older veterans at home, a lot who may be living alone. And so even just for those wellness checks 1 or 2 times a week, that provides them with a lot of support as well. So I'm seeing a lot of the nursing services at home, as well as the use of the non-skilled, the home health aid. But actually, we're also coming to find that there are a lot of veterans who do have family members or primary caregivers who are assisting them with their daily needs. So we're also looking into, like I mentioned, those home respite services, which is more so for caregiver relief, but it does allow for a caregiver from an assigned VA-affiliated home health agency to come in and provide that relief to that veteran's primary caregiver. One of the other home services that we're starting to utilize a lot is a new program called Veteran-Directed Care, in which case the veteran, upon being approved and meeting eligibility, and them having a primary caregiver, that primary caregiver or that veteran can be approved for a specific monetary award to pay for home health assistance. Because one of the other options with having a home health aide from an agency is that, or what I've come to find in my role, is that family members are actually going to apply at the agency that we've assigned for those services, and they're functioning as what we call preferred workers. So they're essentially, providing that care to the veteran, and they're getting pay, from the affiliated agency. But now the VA, seeing that happen so frequently, they've come up with the veteran-directed care system, which in turn, like I mentioned, provides a specific monetary amount to pay for those home health services. So then if the veteran decided, they wanted their caregiver to just be their main caregiver, they don't want to have strangers coming to the home, they're able to, give a certain amount to that caregiver in order to provide that service. So that's one of the other services veterans are looking a little bit more into, the veteran-directed care.
Wow, so that's amazing. So they can get monetary assistance for their own caregiver in the home.
Correct. Now, when they do that, they do have the option of paying their caregivers more or less than the going rate of home health agencies, which is a good thing, as long as it does meet at least minimum wage. But that's one of the good things. And then the only other thing is that in order for us to prevent any duplication of services, they will be opting out of any of those other personal care services, because now they're receiving a monetary amount versus receiving hours for those services. But yes, that is one of the options that they do have.
So with respite care, how much time do you have to give before you can have someone cover you? So for example, you have a caregiver, you have a graduation you have to go to, or a funeral you have to go to, or whatever it might be. Can you do it short notice, or does it have to be planned way in advance if you're trying to get?
So, we always are working with our families and our veterans when it comes to this. We know, things happen, and that sometimes we're not able to get as advanced notice as we would like, which most times is that we ask at least 2 weeks in advance of the respite that you'll be requiring. But we do work with our veterans in case emergencies come up and they do have to travel or, have something going on. We do work with our veterans. And once the respite service is set up and an agency is already assigned, it's that much more easier to kind of just, tweak those days if they're needing that respite. But when it comes to a brand new request for those respite, we definitely ask for the veteran or their families to at least notify their primary caregiver 1 to 2 weeks in advance of the time that they're needing, because if for a new request, there is, the eligibility criteria that we have to go to in order to assign the agency.
Now, part of the most difficult thing I would imagine in the whole process of what you do and have to coordinate it, every day in your job is the hospice part of it, because that's when the person's at their final stages of life. And from the VA standpoint, 'cause I know some hospitals have different time frames for hospice. When do you decide that hospice care is needed? What's the timeline before you see that maybe a demise is imminent? And then also, what types of services do you provide to the family who's going through that process also?
Absolutely. And when it comes to certain services like hospice, the VA, especially Jesse Brown VA, we work well within an interdisciplinary team. So at that point in time, I will pull in my colleagues and my different resources, especially the VA has a palliative care team, and I will pull in those doctors or those nurse practitioners to assess the veteran and their needs. And so then at that point, they kind of take those reins. They'll do their assessments, because the doctor is the only one who's actually, and the nurse practitioner, they're the only ones who's actually able to make a diagnosis. And so in order to do that, they are able to do their assessment. And then once they determine that the veteran is indeed in need of hospice services, that's when I pick back up. And we really have a good rapport with a lot of our agencies, especially hospice, because we know that is something that needs to be a quick turnaround. So it's not that it doesn't take that long after they have determined that the veteran is eligible for hospice services for us to reach out to those agencies and get those services initiated. And then at that point, as I mentioned with our report that we already have, these agencies are already aware of a lot of the needs that our veterans are having, whether that's certain equipment that they're needing in the home, such as mobilized beds, or something as simple as a bedside table, or something more extreme as oxygen. They're able to communicate with our families and their veterans to really identify those needs. And then as far as with the families, they do support the families. They're available 24/7. If there's any calls, questions, or concerns, the families are able to reach out to those nurses and those coordinators with the assigned hospice agencies. And we really have some good feedback that we've gotten about our hospice services and the affiliated agencies, and being able to support our veterans and their families as they do go through that transition.
Wow. I imagine that has to be tough. Do you have any personal experiences or stories you want to share as far as, anything that's touched you emotionally with going through this process? Because you really have a tough job when you think about it. You have to deal with people when they're in the worst part of their life, really, when they're not really enjoying their physical body, and they're going through all types of different pains and struggles and trying to plan for the next stage, the next transition.
Absolutely. And we do come across it often. A story that touched me most recently within this past week of working is a veteran who was going through his hospice care. He was transitioning, going in and out of the hospital, and the son, who was the power of attorney, had been reaching out to find out about all of the resources that was available. I was able to connect them with not only the home health aid, but also the respite. The respite was able to assist with their overnight needs, and the home health aid was able to assist through their daytime, and they were able to work together as a family to kind of fill in those other hours. And then we also had the hospice on board, who was coming in and out even of the hospital setting. So when the veteran would go into the hospital, our hospice agency would send their nurses to the hospital in order to do their assessments to make sure that the veteran was still receiving the care that we know was within their plan of care for their quality of life. So I was really touched when the son had called me on yesterday actually, to let me know that the veteran did pass away. And of course I offered my condolences and to see if there was anything further we can assist with. And the son was more than appreciative of the assistance that he received from the VA. Oftentimes the son would reach out to me, and if I wasn't able to help, there was nothing that I wasn't doing in order to find him the right point of contact or the right resources, and it really showed through. And he was just, it made his transition easy. They were just appreciative, and they just spoke so many high praises of not only the VA and Jesse Brown, but also of our hospice affiliated agency that assisted with that care. So it's really nice to know that we are able to assist them, and to know that, we are doing our best to ensure that the veterans do, receive that quality of life, especially towards the end of their life. So that touched me, and I was very appreciative of him sharing his feedback. But it's good to know that they do find some, relief and assistance in the services that we're, trying to provide.
So for people who may know a veteran, people that are listening to this broadcast or seeing us on YouTube or WUN.com, what would you advise them to do if they know a veteran that could probably use some help, maybe needs a caregiver but doesn't have a caregiver, or maybe needs additional help because maybe they don't have the resources to get the care that they need, but they're veterans. We know that they're veterans.
Absolutely.
Who do they reach out and contact in order to get them affiliated with your programs and start participating and using your services?
Certainly. Now, if they are already connected within the VA healthcare system, they can reach out to their primary care physician. They can discuss with their primary care physician some of their needs that they're requiring at home, and then their primary care physician will put in certain consults or requests that will go to the appropriate party. So whether that is myself as the home health nurse coordinator, or whether that would be the social work for community nursing home, or whatever that service may be, the provider would be that starting point point so that they can put in the right request, and then we will begin to review upon receiving those requests. If there is a veteran who is not currently within the VA healthcare system, or if they know that they haven't filed for service connection, which is one of those things that we will need to determine eligibility for home services, I do have a number for the VA regional office that they can contact, and that's a 1-800 number toll free, 1-800-827-1000. And that's 1-800-827-1000. And that is for the VA regional office. So they can contact that number to file for service connection or aid in attendance if they know that they haven't filed for service connection or are not a part of the VA healthcare system yet.
Adelena,
I'd like to reach out to our listening audience for them to hear the passion regarding the care that Carolina has been expressing on this program, and we want them to know that we have many professional healthcare personnel at the VA that is encouraging them to come in and allow us to care for them. They also offer home infusion programs for self-administration, such as IV and other infusion therapy. And Carolina really exuberate the passion that our nurses have for our veterans. Please come to the VA and allow us to care for you.
And Adelena, I was going to ask you on that note too. It's a good idea, I would say, for every veteran who's not in the system to at least get in the system. So if you're not using services now, maybe sometime down the road, particularly when you're elderly, if you might need caregiver services or anything in the future, it'll make things a lot easier not to have to go through the process of getting evaluated and everything else. So would you recommend that's a good idea for veterans, for all veterans, to actually connect and reach out to their VA just to make sure that they're in the system so that if they do need services down the road, it's much faster and easier to get those services implemented?
We encourage all our veterans and those that are going to be coming out of service to the U.S. and coming into, to the public. We want you to recognize that there's collaboration between the Department of Defense and the VA to make everything streamlined. Do not wait until you need these services. Sign up as soon as possible so that you're in the system, as Carolina stated, and that they can help get you evaluated. And if something does come up, even if whoever's caring for you, if they get sick, if they need to go to a wedding or vacation, then we can streamline that process and get someone in there to care for you, while they're gone. We don't want any interruption in our care.
Adelena Marshall, VA Mental Health RN, and Caroline Stewart, RN, MSN licensed clinical nurse and leader. Thanks for your time. We appreciate you guys. I got to come back sometime in the future.
Thank you for having us.
This is America's.
Thank you very much.
Our pleasure. All pleasures, all ours. This is America's Heroes Group. Make sure you connect with us. You connect with us by calling us. One way is 312-806-2618. Make sure I got those numbers right because I have my glasses on. Yeah, I did it right this time, yeah. So also you can reach out to us on info@americashg.org. And of course, see us on our Facebook page, see us on our YouTube page. We can see the archives of all our shows and also leave us your comments. We'll see you next week. Same time, 4 to 6 Saturdays.